Order till 2. This is the Senate Committee on Health. Welcome. A couple of announcements before we get started. Item number 4 and item number 11. So item number 4 is SB 145 PAN. Item number 11 is SB 546 Leno, will not be heard today. We do have item number 1, SB 4. We're going to do kind of a little bit different than we normally have in the past. As you know, most bills we allow 3 individuals for proponents, 3 for opponents, total of 9 minutes. We're going to make an exception. This one we're going to do a total of 15 minutes for the proponents, and 15 minutes for the opponents. What I'd like to do, I'm anticipating there's going to be a lot of individuals that like to speak either in support or opposition. Public comment, if I can just keep it to just name and position only. So with that, we are going to move on now to item number 1, SB 4, Senator Laura, healthcare coverage, immigration status.
Thank you, Senator. We didn't bring an ascot, but we brought matching t-shirts. Mr. Chair and members, last week, the Speaker of the Assembly and President Pro Tem of the Senate came together to announce an unprecedented effort by the California State Legislature to acknowledge the contributions of undocumented immigrants in California. The Immigrants Shape California package aims to improve equality and provide socioeconomic advancement opportunities for undocumented immigrants in our communities here in California. One of those legislative priorities included in the package was SB 4, the Health for All Act, which expands access to health care for all Californians regardless of their immigration status. Whether we like it or not, or whatever our view is on immigration, we do know that undocumented immigrants comprise 10% of the state's workforce, contributing over $130 billion annually to our state's gross domestic product and generating $2.2 billion in state and local taxes just in 2010 alone. Through your efforts, Mr. Chair, healthcare reform in California has been a huge success, enrolling millions of people in quality healthcare coverage and ensuring the overall success of the program nationwide. In fact, California is the driving force behind the success of the ACA. We have maximized our opportunity to expand Medi-Cal to provide healthcare coverage for low-income Californians, and we have enrolled millions more in quality health plans with vital patient protections through the Covered California Exchange. But despite our efforts in California to implement healthcare reform, there is one significant area where the federal government completely failed. That is the deliberate exclusion of undocumented residents from this program. The most striking example of this is the health benefit exchange, where even undocumented Californians with the means to buy their own insurance without federal subsidies are prohibited from doing so. That doesn't make any rational sense. We know that a recent report by the UC Berkeley Labor Center that a third of all undocumented Californians have incomes above the Medi-Cal eligibility threshold, allowing these immigrants to access coverage to pay for it entirely on their own means makes economic sense and is the right thing to do. Now, California has the opportunity to once again demonstrate visionary leadership and to step beyond the limitations of a failed Congress. Let's provide a pathway to healthcare coverage for everyone in our state. And what we've done since my bill of last year to contain cost in this proposal, I will delineate now. SB 4 directs the state to seek a waiver from the federal government to allow undocumented Californians to purchase their own health care coverage through Covered California Health Insurance Exchange. This would be a significant cost-saving measure. If the waiver application is unsuccessful, this bill creates a mirror exchange under Covered California, allowing undocumented Californians to purchase insurance plans identical to those offered through the exchange. Almost half of the undocumented population in California either already has insurance through an employer or earns an income above the eligibility level for Medi-Cal. Under SB 4, those individuals will be able to buy insurance through the exchange. According to the UC Labor Center report, 53% of all undocumented immigrants in California fall below the Medi-Cal eligibility threshold and lack private health insurance through an employer. This bill expands Medi-Cal eligibility to include those individuals. As noted in the analysis, the state already is providing limited health care coverage to this population at an annual cost of $1.4 billion. Members, that's $1.4 billion, of which $690 million is a direct hit to our general fund. This is annually. Enrolling people in comprehensive coverage is not only a more humanitarian approach, it is also more cost-effective to ensure people have access to preventative care, wellness programs, as well as receive treatment before their condition becomes much more damaging and, again, much more costly. We have made efforts to further reduce the cost impact of this proposal by making the difficult decision to cut the state subsidies from the exchange for this vulnerable population. We will significantly reduce, again, the overall cost of SB 4. We also must recognize the significant impact of the President's recent action on DACA and DAPA, which will reduce the population our bill covers by a third to a half if it's fully implemented. We have to embrace this opportunity to be decisive and to make a historic, sensible, and humane change in our healthcare and immigration policy in California. Taking bold actions is what makes California golden. You're going to hear from a lot of people that will be impacted by this bill today, members, and I want to take a moment to acknowledge the hundreds of people who have traveled to the Capitol over the last year, I would say, to rally in support, to testify, to meet with members and their staff, to tell their stories and to urge support for this bill. Their dedication tells their own story about what this bill means to people from across the state. Expanding access to health care will make a real difference in the lives of the thousands of hardworking California families. Let's take that $1.4 billion we annually spend providing limited coverage to undocumented Californians and do something transformational. Let's reinvest that money and provide coverage for everyone and realize the dream of a truly healthy California. Let's be bold, let's be strategic, let's be leaders. Thank you, members.
Thank you. Anyone like to speak in support? Please proceed, state your name.
Please go. Beth Capella on behalf of Health Access California. We have a number of individuals who are affected who will speak, and then other organizations as well. Please.
Okay, hi, my name is Beatrice Sanchez. I'm 26 years old from Oakland, California, and I'm undocumented and uninsured. So I'm going to share some of my experiences with healthcare growing up in Oakland. When I was 7 years old, I dislocated my elbow at school, and the school called my father to come pick me up to take me to the doctor. Instead, my father came to the school, took me out, and instead of taking me to the doctor, he decided to take the matters into his own hands. So he told me that he was going to count to 3, and after the count of 3, he popped my elbow back in, and instead took me from school to have the day off. When I was also 7 years old, my mom fell into a deep coma. She was diagnosed with diabetes type 2, and miraculously, she woke up after 2 months. Since then, we hadn't seen a doctor. She maintained her own health care, and our family maintained our own health care without having to see a doctor or going to the hospital. When I was 19 years old, my mother and I got hit by a car, and the thought of the cost of having to go to the hospital because of that accident, I immediately stood up. I didn't want to have to go take the ambulance to the hospital, knowing the high costs of it. But what also ran through my mind is the impact that my mother took from the accident. And when I saw her laying on the ground shaking, what came to mind is this is going to cost a lot of money. She has to go to the hospital for this. So the impact of the car accident took a large toll on my mother, and because she has diabetes, her body was not healing fast enough. So my fear of the cost of going to the hospital or seeing the doctor without coverage prevented me from going to the hospital, prevented me from seeing a doctor, prevented me from getting the health care that I needed, or my family from getting the health care that they needed. And even being rejected from clinics and hospitals because of my status kept me from going to the hospital, from getting the health care that I needed. My mother passed away in 2012 because of her diabetes. But with SB4, if my mother was still alive, I'm sorry. If my mother were still alive, it would mean a lot for my family knowing we can get the health care we need. So please, I'm just asking to stand with us and pass as before. Thank you.
Thank you. Next.
Hi. Sorry. My name is Akiko Aspiliaga. I'm a recent registered nurse, a community organizer for Aspire, the first Pan-Asian undocumented immigrant group in the country, and I am also undocumented. For the last 15 years, my family have not access to medical care. My mother is in her 60s, and though she is young at heart, her back pain is becoming more intense, her headaches are becoming stronger and more frequent, her once strong hands are becoming weak, inflamed from arthritis. She has been drinking Tylenol as if it's water, and day after day I beg and plead for my mother to go see a doctor. But she refuses each time because she does not want me to be crushed from the cost of medical care. I remember when she said, Akiko, if I die, you can sell all my jewelry and my possessions so you can bury me without debt. But anak, if I go to the hospital, I will bury us in debt. Growing up, I was frightened to get sick because I knew my family couldn't afford it. In high school, I hurt my knee playing soccer. And for 2 months, I was limping, trying to will my body to bear the pain. I never went to see the doctor. I would just smile and say, didn't hurt that much anyway. It will all heal by itself. I didn't realize the impact it will have on my knee. Nevertheless, I had to stop playing soccer and have strayed away from rigorous physical activity. My mother is a certified nursing assistant who cares for the older population, and I am a registered nurse. Both of us are in the healthcare field, but ironically, we are not able to care for ourselves due to the lack of resources available to us. Give families like mine and Beatrice a chance to access healthcare without fear. The inclusion of undocumented people in Medi-Cal in covered California is the first step to ensure that all Californians have access to healthcare. While the federal government is excluding undocumented families from buying healthcare coverage on healthcare exchanges, we should keep setting the example and not abandon any person behind, including undocumented families. As a California resident, I am proud that my state is a leader in spearheading programs that tackle health inequality. Stand with us and please pass Health for All today. Thank you.
Thank you. Please proceed.
Buenas tardes, mi nombre es Gabriel Águila. Yo vengo de Los Ángeles. Tengo 13 años viviendo aquí en Estados Unidos, pero he esperado por 20 años la residencia. Pero yo quiero decirles que también hace 6 años padezco de diabetes. Y el año pasado me detectaron un tumor pequeño que es canceroso. Me dicen que tengo que esperar 1 año, 8 meses para poder calificar. Yo no tengo un seguro.
Good afternoon. My name is Gabriel Aguila, and I'm from Los Angeles, California. And I have been in this state, in this country for 13 years. I've waited 20 years for my residency, which I have not obtained to date. 6 years ago, I was diagnosed with diabetes, and most recently, I was told that I have a small tumor, and I've now had to wait about 1.5 years to obtain care.
He esperado mucho tiempo. Mi madre no lo sabe. He tenido que callar.
I've had to wait a very long time for care. My mother doesn't know, and I have to keep quiet.
Yo vengo a pedir que se haga una reforma para nosotros. No nomás soy yo, somos miles de indocumentados que no tenemos un seguro.
I come to you today to please reform our healthcare system. It's not just myself, but millions of undocumented individuals that are left without care.
Thank you.
Gracias, y estamos aquí para ayudarte. Ojalá. Okay,
Good afternoon, Ronald Coleman on behalf of the California Immigrant Policy Center. 5 years ago, Congress unfairly, discriminatorily, and purposefully excluded undocumented immigrants from health coverage under the ACA. This exclusion has compounded Congress's failure to create a workable immigration process, and it's totally out of touch with California's values. What we really need is comprehensive immigration reform that doesn't prevent those who would benefit from gaining access to health care or other safety net programs. But unfortunately, from everything we can tell, that's not something that will happen in the foreseeable future. That's why California must continue to be a leader on immigrant integration. This year, you have a golden opportunity to right these wrongs by voting for a forward-thinking, cost-effective solution that will make our state stronger. In our state, the exclusion of undocumented from the ACA means that over 1 million Californians who are our friends, our children's friends, neighbors, and workers who keep our economy going are not going to have access to affordable health care coverage. We've come a long way from the days of Prop 187, and state lawmakers have realized the social and economic benefits of fully integrating immigrant communities into the state of California. Whether it's ensuring strong worker protections or ensuring all Californians can secure a driver's license, or providing common sense solutions against unjust detentions and deportations, we've always upheld the values of California. Investing in immigrant families is investing in our state. The undocumented are 9% of our workforce and contribute over $2.7 billion in state and local taxes each year. They take care of California, and California should help take care of them. This is urgent, and the time is now. We know that President Obama's executive actions, which will ultimately be upheld on appeal, will even cut the cost of health for all in half. But we know today that California already provides health coverage to those approved for deferred actions. So once executive action moves forward, the cost will be lowered. But we can still do this today. For just 2 cents on every dollar, we can cover the entire low-income undocumented population for 2 cents of every dollar we are already spending on Medi-Cal out of the general fund. It's much more cost-effective and just common sense to prevent sickness than to treat it once it turns into an expensive, critical condition or an emergency. It's much more cost-effective to pass Health for All. What we can't afford is for California to wait. Everyone truly should mean everyone. And for those reasons, I respectfully ask for your aye vote. Thank you.
thank you. Anyone else like to speak in support of the measure?
Yes, please. Good afternoon, Chairman Hernandez and committee members. I'm Pete Monzo, President of United Ways of California, the state network of California's local United Ways. United Ways work with business, civic, and nonprofit leaders, and we seek to improve health, education, and financial stability for low and moderate income families. These are 3 interrelated building blocks of a good life, and for that reason, we support SB 4. Creating healthy, educated, and financially secure families is critical to a strong California today and in the future. United Way helps families build assets, yet many families and individuals are one health emergency or severe illness away from losing their financial security. One episode can destroy years of work to build assets and can result in homelessness, loss of a job, or a vicious cycle of debt. United Way began advocating for increased health coverage with a focus on coverage for all children. As we have learned, though, and as studies have demonstrated, families are more inclined to enroll all their children, including those who may already be eligible, when coverage options are available to all family members. As we know, California has many mixed status families. It is far more cost-effective to prevent or treat illness early, as we all know. California taxpayers, as the senator informed us, essentially are already paying for treatment of uninsured individuals seeking the most costly care, such as emergency room treatment for what should be addressed by primary and preventive care, or acute care for conditions that could have been avoided if treated earlier. SB 4 would make more efficient use of taxpayers' dollars by encouraging preventive care and treatment of conditions before they become severe. In addition to the direct health benefits of coverage, being enrolled in coverage is known to improve school attendance and performance and future earnings, creating long-term value and a better return on investment for California. SB 4 would ensure that the public health and welfare of all Californians is more secure. In closing, we look forward to working with Senator Lara and other stakeholders to ensure that all Californians have access to comprehensive health coverage that will help ensure California's future. We ask the committee for your aye votes on SB 4.
Thank you. Before we proceed, we do have a quorum. Let's go ahead and establish that, then we'll move forward. Call the roll, please.
Hernandez?
Here.
Hernandez here. Nguyen? Here. Nguyen here. Hall? Mitchell? Monning? Nielsen? Nielsen here. Pan? Roth? Roth here. Wolk? Wolk here.
Quorum has been established. Apologize. Please proceed.
Thank you, Mr. Chair. I'll be very brief. Eduardo Martinez on behalf of the 40,000 members of the California Medical Association. I want to thank the Senator for his leadership here. Our members believe that a person, regardless of their immigration status, is deserving of health care coverage. Just to put a finer point on what has already been stated, recently a study came out that demonstrated emergency room visits for non-injury related cases has gone up. Essentially, people that are presenting with chronic conditions are showing up in the emergency room because that's the only point of that they can access care. This is a population that would likely be contributing to that. Goes counter to what the Affordable Care Act was supposed to do, and I believe this is a wise investment and would ask for your support.
Thank you. Anyone else would like to speak in support?
Beth Capel, on behalf of Health Access California. Health Access California is committed to quality, affordable health care for every single Californian, and we are strongly in support of this measure, which, as it is before you today, is more modest than the measure that you heard last year. It would expand Medi-Cal for all those who are low income and uninsured. It would give those of somewhat slightly modest income the opportunity to buy coverage through Covered California, which will allow families to buy coverage together. Many of our families, as you have heard, are mixed status, but there's nothing I can tell you that's as important as what you heard from the first three witnesses about the impact of providing coverage. No family should be in a situation where they walk away from an accident without getting the care they need because they're afraid they'll be homeless as a result. Thank you.
Thank you. Anyone else in support? Okay, what I'd like to do, those who are in support, please state your name and position.
Mr. Chair.
We'll get you a new mic. In the meantime, you can just come up here and just state your name and position until we get a new mic.
Mr. Chair and Senators, Seth Bramble here on behalf of more than 300,000 members of the California Teachers Association in strong support.
Thank you.
Michelle Cabrera on behalf of SEIU California. Oh, there it is. Michelle Cabrera on behalf of SEIU California and our 700,000 members in strong support and in utter awe of the courage of our undocumented youth today. Thank you.
Very much.
Kimberly Chen with the California Pan-Ethnic Health Network in very strong support.
Thank you.
Gabriela Sard with the National Immigration Law Center in strong support.
Fredo Medina on behalf of Ultimate Health Services, also in strong support.
Fred Main on behalf of CalPACE, the 11 programs for the all-inclusive care of the elderly, in support.
Emily Park from Asian Health Services. I'm also a DACA recipient. I serve the underserved API immigrant patients in Chinatown, Oakland, and I'm in support of Health for All.
Thank you.
Tu Quach on behalf of Asian Health Services, also in strong support.
Thank you.
Philip Bautista, registered nurse and elected membership director of the American Nurses Association of California, and we are in support of this bill.
Thank you. Over here.
Kathy Dressler, the Children's Partnership, strong support.
Chair and Member Sean South on behalf of the California Primary Care Association in strong support.
Jody Hicks on behalf of the California Academy of Family Physicians in strong support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Latoya Ramsey, National Association of Social Workers, California chapter, in support.
Dolores Duran Flores with the California School Employees Association, representing 218,000 classified school employees across the state in support.
Linda Kurohara, representing the United Methodist Church of the California Nevada Annual Conference, and strong support.
Stella Kim with the national organization Young Invincibles, representing young adults in the entire country, and we have 2,000 signatures in strong support.
Pete Wiley with the California Partnership and the Health and Human Services Network, with personal testimonies from our members across the state in strong support.
Hi, my name is Perla Flores, and I'm in Physicians for a National Health Program, the California chapter, as well as California Health Professional Student Alliance and the All Care Alliance, with 120 organizations in strong support of SB4.
Alice Kessler here on behalf of Equality California, as well as the California School-Based Health Alliance, both in support of the bill.
Hi, Dina Krippenstraw. I'm a nurse of Nurse Advocate Associates and United Way volunteer, and I strongly support this bill.
I'm Stephanie McLemore Bray, President and CEO, United Way California Capital Region, and we are in strong support of this bill.
Sarah Flocks on behalf of the 2 million members of the California Labor Federation in strong support.
Linda Way with Western Center on Law and Poverty in strong support.
Rebecca De La Rosa with the Latino Coalition for a Healthy California in strong support.
Christina Romero, Planned Parenthood Affiliates of California, on behalf of our 115 healthcare centers in strong support.
Mr. Chair, member Stephanie Roberson on behalf of the California Nurses Association, representing 90,000 registered nurses in the state of California in strong support.
Jeanette Sanepatin on behalf of MALDEF, the Mexican American Legal Defense and Educational Fund, also in strong support.
Good afternoon, Mr. Chair and members of the committee. I'm Santosh Siram Santana, representing the California Asian and Pacific Islander Budget Partnership in strong support.
Good afternoon, Chairman, members of the committee. Noé Paramo, representing California Rural Legal Assistance Foundation, on behalf of the Having Our Say Coalition and the residents of Fresno who traveled here from the Central Valley, in strong support of SB4. Thank you.
Pilar Chiavo, representing California Campaign for a Healthy California, which is over 1 million members from labor and community, in strong support.
Susie Costa with the Advancement Project in strong support.
Hi, my name is Amy Bauk. I'm a resident of Nevada County. I'm a constituent of Assemblymember Nielsen and in strong support. Thank you.
Hi, Rita Medina with Coalition for Humane Immigrant Rights of Los Angeles on behalf of our organization and all of our members throughout the state, strong support.
Hello, Michelle Stoll-Parvensky, Children's Defense Fund California, also on behalf of the California Children's Health Coverage Coalition, in strong support.
Hello, my name is Sandy Valenciano, and I'm with California Immigrant Youth Justice Alliance, and we're an organization of 13 organizations all throughout California in strong support of SB4.
Hello, my name is Leima Murtaza, and I'm here on behalf of Asian Americans Advancing Justice Sacramento in strong support.
Rosa Akil on behalf of Placer People of Faith Together in strong support.
Camille Duria, representing Pico, California, and half a million of families in California in strong support.
Hi, I'm Myra Duran with California Latinas for Reproductive Justice in strong support.
Hello, I'm Sherry Moore at Fresno Center for New Americans in strong support.
Good afternoon, Senators. Sylvia Castillo with California Family Health Council, as well as the Sacramento and Bay Area Women in Healthcare Reform Coalitions in strong support.
Marlene Velasquez with La Familia Counseling Center in strong support.
Betsy Imholtz, Consumers Union, the advocacy arm of Consumer Reports in strong support.
Good afternoon, Chair and members. Anna Hasselblad with California Coverage and Health Initiatives in strong support.
Amparo Cid from Fresno, California, in strong support.
Alejandra Tovar, Fresno County resident in strong support.
Richard Cow from Asian Health Service in strong support.
Lisa Edwards with the Obamacare Network in strong support.
Jack Ribbon representing Unite Here International Union in strong support with all 300,000 of our members, and we thank the author for offering this bill.
Thank you. Is there any opposition to the measure? Seeing no opposition, is there any questions or comments from any of the members? Senator Roth.
Senator, I wonder if you could just clarify something for me. With respect to the adult population that's going to be incorporated into Medi-Cal, do we have any general estimate as to cost?
Of the DAPA folks under the administration, or just, or the in total, the people that are not covered under the executive action?
Yes, the latter.
Beth Capel on behalf of Health Access California, Senator. As the author, as Senator Lara said, about 62% of the cost of full scope Medi-Cal is covered already through restricted scope emergency care. There are additional cost offsets as a result of the managed care organization tax and the existing law on state-county realignment that help to further reduce that cost. So as Ron Coleman said, it costs about 2 cents on the dollar to expand coverage to these adults.